Project Prepare is an organization that advocates for compassionate, comfortable, patient-centered healthcare. Our educators teach future healthcare providers how to do intimate exams by guiding them on their own bodies. Project Prepare's sexual medicine curriculum also deals with the talking part of sexual and reproductive health. Then students have the opportunity to work one-on-one or in small groups with patient educators.
So the idea of getting or having HIV is really scary to me, and I don't know what I'd do if I got it.
I can really sympathize with that. HIV can be extremely scary. I actually had a friend seroconvert recently. It was very hard.
They get feedback, direct feedback from trained educators. And these patient educators, most of whom have received at least 60 hours of training in human sexuality.
So one of the things that came up during the patient interview was you mentioned that one of your friends had seroconverted recently. And I can understand the desire to have empathy with your patient, but it's a little bit of a boundary issue in that there's a difference between building rapport with your patient and personal disclosure. So you kind of want to stay away from personal disclosure.
Project Prepare has developed a sexual medicine curriculum in which we teach future doctors to talk to patients about sex and sexuality. We teach them how to ask questions about sex, answer questions about sex, and deal with confusing situations which are bound to happen throughout your clinical practice.
So I actually had to leave my husband.
Oh, that's terrible.
Yeah, I found out he was doing drugs.
Oh, that is awful. It says on your chart that you smoke. How many packs a day do you smoke?
So one of the biggest mistakes that clinicians will make during a patient history taking is not picking up on patient cues.
Yeah.
So one of the things that happened during our interview was I mentioned I had to leave my husband and I found out he was doing drugs.
Yeah.
And what happened? You changed the topic.
Exactly.
So when your patient opens up a door, go ahead and follow on through. If they mention a topic, ask them about it.
As far as I know, Project Prepare is the only organization in the country that provides transgender patient educators so that students can receive immediate feedback from transgender people who have experienced the challenges of going to the doctor.
And so what words do you use to describe your genitals?
Yeah, personally, I use frontal and back wall, but lots of my friends use different terms.
Okay. Well, the reason I'm asking is that we just want to make sure that you're not sharing anyone else's bodily fluids, because that could increase your risk of transmission of STIs.
So for all your patients, regardless of their sexual orientation and regardless of their gender identity, what is most important in terms of risk assessment is finding out what are the sexual practices that your patients engage in. And you did a great job of starting and introducing that series of questions by telling me why you're asking that series of questions.
They leave our sessions feeling empowered, feeling supported, better about doing these kind of interviews, and ultimately that's the emotion that we want their patients to feel.